Hi, I'm Pranav Bajaj, co-founder of Medulance. I believe that words like unreliable, unresponsive, unregulated have closely been associated with the medical transportation and the emergency response services in India. Today, we have apps to track our food, but not ambulances. Also, over a period of time, back about 10 to 12 years back, the medical transportation industry was limited to the state governments providing services directly to the people at large. Um we've seen a lot of gaps in such services wherein the government was working on public private partnerships with a few private organizations to provide such services. However, we felt that there was a lot of lack in terms of quality, accessibility, maintenance of the ambulances, and also availability of highly trained paramedics to provide pre-hospital care within these ambulances as well. I believe over a period of time, a lot of private ambulance service providers have come into place in each of these states and cities, especially tier 1 and tier 2 cities. The reason that private ambulances have come in is because of the demand for ambulances and also demand for high quality ambulances, I believe. These private ambulance service providers have recently also been regulated by the government under the AIS 125 standards to ensure that there is standardization and regulation in the medical transportation services industry today. Currently, I believe players like us, Medulance, okay, who've used something as simple as geolocation, proliferation of smartphones, digitization in of medical records to shave minutes of the response time, have been very successful in providing quick and reliable emergency care. Not only we've been able to use a network of ambulances across cities, but by using something as simple as geolocation, we are able to dispatch the closest possible ambulance to a person's location, which I believe is the key because I believe that help should be given when it matters the most. So I believe that the ambulance industry today, right, even if we take into consideration the ambulance services market managed by state governments today, is more than $1 billion industry. And overall, if we talk about integrated pre-hospital care services, which not only includes ambulances but medical rooms and training services for paramedical staff, we can surely say that the industry is worth about $5 to $6 billion in India alone, and about $75 billion across the world in this case. Talking about the challenges in the emergency response space, I believe that the first challenge why someone is not able to provide a scalable solution to the ongoing problems in the country is because it's not a recurring service. It's not like a cab industry today. It becomes very difficult to build a top of mind recall because the general customer requires this service maybe tomorrow or not maybe in the next 10 years. Hence, it becomes very difficult to build a top of mind recall over a period of time. However, I believe that challenges have always existed with the state-run services in which I've already highlighted that quality of paramedical staff, quality of ambulances, lack of technology in emergency response, and I also believe lack of awareness amongst the citizens have not allowed people to get quick and reliable help. Over a period of time, significant developments in technology, I also believe in medical devices, have helped us improve the emergency response landscape in the country. However, COVID 19 did expose the challenges in the emergency response space, not only in India, but I believe across the world. What we also saw during the second wave of the pandemic was that apart from lack and unavailability of ambulances, paramedical staff, doctors inside the ambulances, there was a significant spike in hospital admission times. So this means that patients were spending a lot of time within the ambulances itself, outside the hospital. So the average hospitalization timeline went up to about 2 to 3 hours, which is generally about 30 minutes, right? So this already made that ambulances that were already existent became more and more unavailable. Also, I believe that, as I said, lack of technology in emergency response and integration between hospital services, diagnostic services, and other healthcare providers is a must today to ensure that we do not foresee these challenges again. So the COVID learnings that we had was significant, right? Firstly, we realized there has to be a data-driven approach to emergency response as well. Data-driven approach, uh, we felt that needs to be catered to in two parts. One is at the manpower management end. So we have sufficient call center executives to cater to any spike that the third wave or a fourth wave might see. Also, we also believe that data-driven approach needs to be also catered to for the ambulances itself. So we can strategically place these ambulances across locations, especially where we see hotspots or high spike in cases. So we are already more prepared. Also, I believe that coordination with the hospitals today is very important so that we know where the beds are available. So there needs to be a data-driven approach there as well, so that hospital bed availability is highlighted on a dashboard which is available to the emergency response services. So such a situation never arises where an ambulance is standing outside the hospital with a critical patient for 2 to 3 hours itself. Also, I believe that we also realize the importance of sanitization and fumigation processes. Even though COVID brought this in, this is something which has become sort of a mandatory practice in the emergency response sector. PPE kits, regular sanitization, daily temperature checks for paramedics and drivers have become the protocol. So we started back in 2017, and it's very important to understand why we started. It was also the absence of an efficient ambulance service that resulted in one of my co-founders, grandfather, who passed away due to the unavailability of ambulances in 2010. So back in 2016, right, we realized that platforms like Ola and Uber had come in and used something as simple as geolocation, proliferation of smartphones. We thought, why can't we do it in an industry where the problems were much more prevalent? As I said, the industry was unresponsive, unregulated, and unreliable. So it was very important for a company like us to find solutions that were scalable, local, and solving the problems that existed in the country. We started by aggregating private ambulance service providers in Delhi NCR, right? We realized that we quickly checked these ambulances for their legality in terms of registration certificates, drivers, and paramedics having valid licenses to onboard a fleet of about 350 ambulances, high quality ambulances in the city of Delhi to start with. We also learned something very quickly. We realized that this is not a general B2C model, right? Even though we are servicing the public at large, as I said, that people do not require ambulances regularly. It becomes very difficult to form a top of mind recall, as it's not a recurring service. So we shifted to a slightly B2B model to make sure that we have a similar impact targeting the same population, yet also ensuring that it's a sustainable business model so it can continue impacting millions of lives over a period of time. How we did this was we started working with organizations, employees of organizations, insurance companies, even tapping into large-scale residential societies to find a captive audience so that we could not only provide quick and reliable help, but also ensure that we have a captive audience who knows where to reach out to when help is needed the most. Today we have a subscriber base about 50 lakh subscribers, a fleet of about 5,000 ambulances across 40 cities in the country. We've been able to save and assist more than 5 lakh lives and about 1 lakh plus COVID suspect positive patients till date. So Medulance has made significant progress in the last 4 years. As I said, we started back in 2017. We were also able to turn profitable in the financial year 1920. We saw a 5x growth in terms of our revenue and much more growth in terms of the number of lives saved from the financial year 1920 to 2021. Today, Medulance has a fleet of about 5,000 ambulances spread across 40 cities and has saved and assisted more than 5 lakh lives and more than 1 lakh COVID suspect and positive patients. What we want to ensure is that we want to keep partnering with state governments. We've had a successful partnership with the government in Delhi. We want to keep ensuring that we can take our model to at least 2 more states in the next 2 years for that matter. We want to add a fleet of about 5,000 more ambulances and even reach to more tier 2 and tier 3 cities today. Medulance continues to be a profitable entity. The idea is we wanted to ensure that we do not act as a social service but continue impacting millions of lives in the emergency response sector over the years and want to continue doing so. We also want to launch an air ambulance service. We feel that there is significant impact that a reliable and affordable air ambulance service can have. What we need to do is we need to integrate the right kind of charter companies and medical staff to come together so that we can make the service more reliable and affordable to the people at large. Medulance also wants to ensure that we can continue working with insurance companies, organizations, so that we can keep building a captive audience, as I said, so that they know where to reach out to when help is needed the most.